Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to cover the topic of slip disc. And as you can see, just wanted to give some general information about what is slip disc and what is the issue happening when they say it is slip disc. So it's in your vertebrae, it's your bones covering your spinal column. There are these discs in between your vertebrae, which is basically kind of a cushiony, gives you flexibility for your spine to move, for you to bend and do that. So that is what this is called as disc or intervertebral disc or foramen. There's so many names to it, but that is what it is. It's kind of a cartilage which has semi-flexibility made up of collagen and other proteins and basically gives you flexibility to move with your spine. So, what do you mean by slip disc? So, basically, a herniated disc is called a slip disc, which is right here. Which happens is basically your disc kind of because of your movement of your body or some kind of reason is kind of bulging out and hitting your spines or your vertebrae. So if I go back and look here, right above, so there is another vertebrae on top of this, and then there are nerves going around here. So when this kind of bulges out, it hits those nerves and creates like a pain to you, and that's what you call it as herniated disc or slip disc. Then there are other issues with the disc, which is basically you see this is your disc starts to degenerate due to genetic diseases or some kind of issue you're eating bulging again. So this is the stage where it starts to get slip disc, and this is completely slip disc where your um, disc has extended into your spinal column and you're hitting your nerves and causing pain. Then thinning of your disc is again due to age, and then degeneration due to bone degeneration, that is again due to age. So slip disc is nothing but your that disc basically is getting pushed and pressure and kind of herniates, comes oozing out and hitting your nerves and causing pain. More common issues is because of improper lifting techniques. So people lift with their back. Basically, you can see this, follow this guy, and he's just lifting it with the back muscles rather than using the leg muscles. And that, if you are day to day, you're doing something, it is going to lead to, slowly will lead to your slip disc. Right way is to use your leg muscles to pull up things. Now, this is not the only way you can get slip disc. It is also if you're sitting for too long and you don't move around, or if you're biking for too long. Biking is also on not on a regulated pathways. It's gonna constantly jerk this thing and jerk your vertebrae, and you would lead to and then extra work around it would lead to this slip disc problems. And then other things are aging. So major reason is not paying attention to your posture, not paying attention what you're doing when you're doing, not make sure you do not engage your back too much into it. Try to use your legs or your hand muscles to do things around the house or around anything you're doing. So most of the time, 9 out of 10 people who get slip disc, they don't need 9 people won't need surgery, and you can treat it with physical therapy, some medication using anti-inflammation so that it doesn't hit your nerves and slowly bring your bulging a little bit down. Physical therapy is the major thing which will help you bring back your motility, improve your posture. Basically, the physiotherapist will work with you how you're actually doing day-to-day tasks and how is your posture bad, and helps you bring your that bulging will slowly over a period of time kind of come back in. So most of the time it can be treated with physical therapy or a small amount of anti-inflammatory medication. But if there's too much pain, then there are some spinal injection again, tries to avoid getting pain and then slowly work with physiotherapists to bring back bulging back down to normal. And avoiding bad posture is more important. So this is a short video to explain what is slip disc and how you can avoid it. And if you have it, it's easily treatable using physical therapy and some kind of medication, depending on how severe it is. Uh, but if it is too much severe, then doctor might ask you to get a surgery, but that's in very severe cases. So most of the time, medication and physiotherapy should help you with your slip test. So with that, I'll end this show and I'll see you on the next one. Bye for now.